form, the scalp is part of it. So the head, when you look at it, it's normocephalic. That means comparative size to the rest of the body is it approximates it. Okay, and then it's centered, it's erect. Okay, it's not tilted to one side. Okay, and what you call this? It's a little, it's round, not round as a ball, but roundish. Okay, and then we now check for the consistency of the scalp. So again, you perform this.
That feels so good.
That's why I volunteered.
Keep going, shit.
That's right.
Okay, so you assess for the consistency of the scalp. So this one should be smooth, okay, and it's firm. Okay, we've had patients wherein they underwent a brain surgery, and so a part of the skull was not returned. So when you palpate, there's a soft spot.
That's the brain.
No, that's like they cut
it's
part of the
just
skull
Okay, right.
off to
the
let the brain
skull.
expand out sometimes. Like
So do you always go from like the middle?
No,
And
it's
then-
up to you, as long as you do a thorough,
Okay.
a thorough examination.
You got
Okay.
some gel in your hand.
Yeah, you can have hairspray, gel, dry shampoo.
All right, so you have now observed, you have to observe the face. So the face, again, check the eyes. Are they on the same plane? The nose, is it in the midline? Okay, the ears, the lips. Okay, so when you're doing the assessment, you always have to stand in front of your patient. The only reason why I'm here is so that you can see. Okay.
Are we
so,
talking to it too? Like,
Oh, yeah.
said, like,
So you
oh,
tell
I'm
me.
gonna do this.
Yes, so I'm assessing the head. I'm assessing the head. The head is this. What are your findings?
Okay.
Okay.
So you tell the patient what your findings
No,
are.
you're telling me.
Like on the dummy.
But right.
No, it's gonna be
this is
your. You're gonna have to bring your
Okay.
classmate. It's
Okay, I got you.
Okay. All right. So we check now for symmetry of the facial features. This we ask the patient to do 5 different facial expressions. So we ask the patient to smile. Okay. Symmetrical. Yes.
Yes.
Mhm.
Okay. Ask the patient to frown.
Mhm.
Okay. Ask the patient to make puff the cheeks. Okay. Raise the eyebrows and close eyes idly. Okay. So we're looking at symmetry with regards to these different facial expressions. Got that?
Yeah.
Okay. And then we assess now the neck. So again, the neck is in the midline. Do you see any bulging masses, any swelling? Okay. So it's symmetrical, it's centered with the head, supporting it, supporting the head, I should say. Okay, then we assess the movement. When you assess the movement, you have to give simple instructions. Do not say flex your head, extend your head. That's not how it is. When you're doing these movements of the head, you're assessing the sternocleidomastoid. So we ask the patient chin to chest. Now we need to assess also the muscle strength. So ask your patient to resist this hand. Resist. Okay. So muscle strength will be about 3 or 4. Okay, which is very good. Now, can you please look at the ceiling? So this is extension. Again, resist. Okay. When you ask the patient, when you're trying to assess the muscle strength and the patient is looking up, please look at the ceiling. Okay. You're not assessing the muscle strength that way. You're applying an opposing force. Okay. And then we ask the patient, can you bring your right ear to right shoulder? This is lateral rotation or lateral abduction. Oh. Wait.
Oh, I think it's the poker.
Okay. Resist. Okay. Left ear to left shoulder. Resist. And then turn your head to the right. Resist. To the left. Resist. Okay. So these movements, they are all to assess the function or the activity of the sternocleidomastoid. And then we ask the patient, can you shrug your shoulders? Okay. Resist. This is the trapezius. Okay. Now we assess the temporal artery. So the temporal artery is here. Okay, so feel it. and then use your the bell of your stethoscope to listen for bruits on both sides. Okay, and then we assess the temporomandibular joint. So this is the tragus. Just in front will be temporomandibular joint. Can you please open your mouth? Okay, so check the opening. Is it from 3 to 6 centimeters? 3 to 6 centimeters wide? Yes, no? Okay. Okay. While the patient is opening the mouth, you're also assessing, palpating the TMJ. Now ask the patient to, can you move your lower jaw to the right and left?
See, I can't do
click,
that.
Click, click, click.
You feel it?
Yeah.
What? Really?
I
Oh,
wanna-
okay, I hear it.
See?
Yeah, I'm abnormal.
No. Okay, so that is the movement of the TMJ. Okay, right, left, up, open, close. Okay, and then we assess the trachea. So like we said, when you're assessing the trachea, start from the mentum. Okay, look for the cricoid notch, and then go down. This is the thyroid cartilage. Okay, go lower, you will feel the tracheal rings. Okay. All right, and then we ask the patient, can you swallow? While you observe the movement of the trachea. Symmetrical? Okay, and then we assess the thyroid gland. So when you assess the thyroid gland, this is the time when you stand behind the patient. So we ask the patient, can you turn your head to the right? Just a little, okay, and then drop your head. Okay, so when the patient turns the head to the right, you're assessing the right lobe. So your left hand, okay, will push the structure, the trachea, or together with the thyroid gland towards the right. And with your right, feel for the lobe of the thyroid. Okay, now ask your patient, now please swallow. Okay, so when the patient swallows, you will feel the movement of the trachea. Okay, you will not feel the lobe of the thyroid normally. Okay, turn now to your left. Okay, so when you're assessing, it's like you're strangling your patient because this one will push, okay, while this one here will palpate. Okay, so again, can you please swallow? Okay, so there is movement of the trachea, no enlargement of the thyroid gland. Okay, now after you do the palpation, again, listen to the thyroid gland for bruit. This time, ask the patient, can you please hold your breath? Listen. Okay, relax. Okay, and then again, hold breath one more time. Okay, listen to the thyroid gland for any bruit. Relax. Okay, so this is the assessment of the neck area. And then we do the assessment of the cervical lymph nodes. So we have preauricular, this area here, preauricular. You have the postauricular.
He's got a hematoma on his left knee now.
Here.
From hitting the bed.
Okay, so you have the postauricular, and then you have occipital, will be here. Okay, and then we have submental. For the submental, just use 2 fingers, and then you have submandibular here. You have the jugular digastric all the way towards the earlobe. Anterior cervical, just lateral to the trachea. Posterior cervical, behind or to the back of the sternocleidomastoid. And then you have the supraclavicular. Okay, so these are the different lymph nodes. Question?
What does it mean if you have a bounding temporal pulse?
Well, if you're young, as long as it's elastic, okay, it does not mean anything.
Okay.
If it's rigid or what they call this, if it's rigid or hard, then that means there might be some, sclerotic changes. It's now become, it has become a little stiff. That's why you have to listen to the fluid. Possibility of fluid. Any other questions? Okay, so I will always say, when you do the palpation of the lymph nodes, do it in order, so that you don't miss any. Because if you say, no, I'll do it my way, okay, I'm going to bet you'll miss something. Okay, questions? All right, so practice, especially when you're doing assessment of how you would assess the temperature of the skin, and of course, how you would assess the thyroid. Okay, thank you.
Never had any camera point at me for like Kim Kardashian.